Quick note. This is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Most of us feel fine, so we skip the doctor's visit. But here's what research shows. By the time you notice symptoms, the disease has often been quietly progressing for years. Take Sarah, 30, whose routine blood work revealed prediabetes, or James, 45, who discovered high cholesterol during a screening he almost skipped. Early detection isn't about paranoia. It's about catching problems when they're easiest to manage. Today, we're walking through what comprehensive screening looks like, based on Mayo Clinic and NIH guidelines, so you know which tests matter for your age and risk. According to the CDC, early detection makes the difference between managing a condition with medication versus facing major surgery or permanent damage. The NIH points out that many serious conditions, high blood pressure, high cholesterol, certain cancers, are called silent killers because you won't notice them until they're advanced. Early screening catches these at stage 1 or 2, when your options are typically simpler and outcomes are much better. It's not about adding anxiety. It's about being informed and empowered to make decisions about your health before a crisis forces your hand. Let's break down what Mayo Clinic recommends by age. In your 20s to 30s, the basics are blood pressure checks, cholesterol screening every 5 years if normal, and for women, cervical cancer screening starting at 21. In your 40s, you add baseline mammograms for women and more frequent cholesterol checks if risk factors emerge. By 50, colorectal cancer screening begins for most people, and men should discuss prostate screening with their doctor. Medline Plus emphasizes that if you have family history of disease, diabetes, or high blood pressure, your screening timeline moves up. The key: don't wait for symptoms. Let's look at 3 screenings that catch the most common issues. First, blood pressure. The Cleveland Clinic notes it often has no symptoms, but it strains your heart and arteries silently. A simple check takes 60 seconds. Second, cholesterol panels show your heart disease risk years before you'd feel anything wrong. Mayo Clinic research shows LDL, HDL, and triglycerides paint a complete picture, and they're modifiable with diet, exercise, or medication. Third, cancer screenings. Colorectal, cervical, breast, prostate. Catch tumors when they're small and localized. Survival rates drop dramatically once cancer spreads. These 3 categories catch the majority of preventable deaths. If you have risk factors, screening starts earlier and happens more often. Family history of heart disease, diabetes, or cancer pushes your timeline forward, sometimes by 10 to 15 years. Smoking, obesity, sedentary lifestyle, and high stress all signal that you need baseline testing sooner. Medline Plus recommends documenting your family medical history and sharing it with your doctor. It's one of the most valuable health data you can provide. Certain ethnic groups have higher risks for specific conditions, so culturally aware screening matters. The bottom line: your personal risk profile, not just your age, should guide your screening plan. If you haven't had a preventive visit in a while, here's how to set one up. Call your doctor and say you'd like a wellness visit or preventive screening appointment. Be ready to share your age, any symptoms, and your family medical history. Ask specifically, what screenings do you recommend for someone my age? If your doctor says everything's fine without doing tests, ask which tests would be appropriate. Bring a list of questions. Mayo Clinic emphasizes that good healthcare is a conversation, not passive. You're a partner in the decision-making. While we focus on early detection, some symptoms should send you to a doctor immediately. Chest pain, severe shortness of breath, sudden vision changes, unexplained weight loss, persistent cough, or changes in moles. These need urgent evaluation. The CDC flags unusual bleeding, persistent headaches, or digestive changes lasting more than a few weeks. Note: we're not diagnosing. Only your doctor can do that. These patterns should prompt a medical visit, not a wait-and-see approach. Trust your body. If something feels wrong, get it checked. Early action on symptoms plus regular screening equals your best defense. Here's what you can do right now. First, call your doctor and schedule a wellness visit if you haven't had one in a year. Second, write down your family medical history, parents, grandparents, siblings, and note major illnesses. Third, take baseline measurements, blood pressure at a pharmacy, height and weight for BMI. Fourth, make a list of questions for your doctor based on your age and risk factors. Fifth, mark your calendar with screening appointments once scheduled. Small action today prevents big crises later. Start with just one step. That builds momentum. Early detection isn't about being anxious or over-testing. It's about being informed. The data from Mayo Clinic, the NIH, and Medline Plus is consistent. Catching problems early gives you more options and better outcomes. Start with the action steps we've outlined. Talk to your doctor about your personal risk profile. And if you want to learn more about specific screening tests, that's exactly what we're here for. What type of health tests are you interested in? Comment below and we will make a video about it.